Hello, this is Fred Goldstein, and I'm at the Jefferson Population Health Colloquium, and I'm at the Qlik booth, and I'm here with Joe Warbington and Eric Pennington, and they are former Epic employees who now work with Qlik, and we're going to join them on an interesting conversation regarding the product and some of its features.
One of the more difficult aspects of my time at Epic, working with organizations within the analytics space, and we've talked, I think you've had some similar experiences, is being able to have very meaningful application of those analytics organizationally. So there's a number of components of that. There needs to be higher adoption, there needs to be the ability to take action on the data. But if there was a single item or a single issue that you think you could identify that would be one of the biggest movers or the biggest impacts for an organization to meaningfully deploy analytics, what do you think that item is?
I think with what we're seeing, when we were working with the organizations, they had so much to do already with all the technology that if we gave them another piece of something to jump out, do something else, and another thing that they had to learn, it was going to be an issue. So if we can figure out how to get it into the workflow and ease it in, so they don't even know they're using analytics, It's just part of what they're doing already in the EHR if they're in Epic. That's going to be the biggest thing we can do, is just make it easy and transparent.
Sure. So have you seen a lot of organizations deploying these type of solutions where the users are not necessarily aware they're using analytics?
I've seen a few where they don't even know that they're using our technology at all, right? They don't know that it's Qlik. They think it's just Cerner, they think it's just Epic, and it's part of it. So it actually blurs the lines quite a bit, and that's really what we want. The IT department's pushing that out, but they just think it's part of the application itself. It's part of the EHR.
Yeah. And I think that's a very important component, is that organizations, certainly from the IT side, tend to be technology driven. They tend to really focus on the technology or what their technical architecture or infrastructure supporting whatever technical initiative they're moving forward with is. And more importantly, from a clinician standpoint or from a business user standpoint, they want to deliver results. And those results can be agnostic, or more accurately, just do not care about what technology they're leveraging.
Right.
Of course, there's technology components that Qlik, and helps really build out some components, make things easier to deploy, faster to deploy. But again, it's not relevant to the end user what technology.